Daytime Tri-Cities is sponsored by SFG Medicare. On this edition of Medicare Tips with Andrew, we'll be talking about the pros and cons of going with a Medicare Advantage plan. Good morning, Andrew. How are you doing?
I'm doing great.
You know, we hear about these Medicare Advantage plans all the time, a lot of benefits at zero cost, but what are some of the cons associated with one of these Advantage plans?
Well, there is no goose that lays the golden egg. There's always going to be pros and cons to everything out there. Probably the biggest con to an Advantage plan is it does have a network.
Does that really, that con is huge. Does that mean that, you're limited on your choice of doctors?
Yes and no. So now there's thousands upon thousands of doctors that you can go see, so you're not really pigeonholed that you can only see a handful of doctors. And a big change since 2020 is that a lot of the plans have went national. And what that means is as long as they're in the network, you can go anywhere in the country.
Now, what would be the second biggest con associated with Advantage plans?
Probably the second biggest con is that you do have copays. So it's not going to cover all the 20%. The good thing is that it's very limited on how much those copays are.
How high are those copays?
They're all limited. So
Yeah.
I actually had someone just call me last week and he said he's going to have a cataract surgery and what can he expect to pay? And it was under $200 that he had to pay to have his cataract surgery.
Now, is there any other cons associated with Medicare Advantage plans?
Probably the only other big con is that you have to have prior authorization.
Do a lot of these things get turned down by insurance organizations?
Not really. So prior authorization is something that you've been dealing with your whole life with your employer plan. Prior authorization just means that the doctor has to tell the insurance company, why you're having a procedure done. And, that's to prevent medical waste.
So it sounds like there's some cons there, but it kind of doesn't sound like it's that big a deal.
Yeah. Like I said, there's always going to be pros and cons to everything, but the cons are very limited, and we're seeing more and more people go with the Advantage plans because the pros, the low cost, the good value, a lot of choice of doctors and things like that are outweighing what the cons are.
So if someone wanted to review their plan, see where they stand, they just need to contact you, correct?
Yeah, so that's what I do is I sit down with people one-on-one, look at their benefits, look at their health, their doctors, their income, all those factors to help them figure out, what they need to do or what they should do.
And Medicare Advantage plans, we see them on commercials all the time. I mean, they're out there. So you just need to take everything, make sure it works for you, make sure it's legit, and you can help with all of that.
Right. The tough thing about when you're dealing with, especially with Medicare insurance, is each plan is a little bit different on how they cover things or their network or their drug coverage. And so what may be great for your neighbor or your sister or your brother or something like that may not necessarily be great for you. And that's why I'm a broker and deal with multiple different companies.
Right.
And so I'll even have husbands and wife on different plans just because they have different, health situations.
Do you have a lot of people contact you about these plans?
Yes, I stay pretty busy. I've been doing this coming up on 16 years now.
Right.
And it's pretty amazing, how I've been able to help a lot of people here in the Tri-Cities.
And getting in touch with you is really easy.
Yeah, so everything I do is on an appointment basis. So that number that I always give people, that's my actual cell phone.
Right.
And so people can call me directly and always get a hold of me.
We're going to give them that number right now. Andrew, thanks.
Thank you.
Folks, right there, call Andrew. That number right there, it's his cell phone, 423-737-1865. If you've got questions about Medicare Advantage plans, call Andrew. He's got everything you need to know. The preceding portion of Daytime Tri-Cities was sponsored by SFG Medicare.